clinicians have ideas that they have the opportunity to discuss with researchers and kind of be more collaborative to move our profession forward. A lot of my ideas for like case studies have come from just conversations at conferences.
Up next, we have the pleasure of speaking with someone who's not only dedicated to advancing her own clinical skills, but is also shaping the next generation of orthopedic manual therapists. Dr. Amber Custodi is a fellow of AOMT and serves as the Orthopedic Residency Program Coordinator for Brooks Rehabilitation in Orlando, Florida. She brings a lifelong learning mindset to her work, mentoring residents, contributing to research, and restoring patients' quality of life through her own hands-on care. In our conversation today, we'll explore Amber's journey from residency to fellowship, how she balances clinical practice with mentorship, and her insights into the biggest opportunities in orthopedic manual therapy today. We'll also hear her thoughts on how to better translate research into everyday clinical practice. This is Hands On, Hands Off. Amber, welcome to the show.
Thank you. Thank you for having me.
How's your AOMT 2024 conference experience so far, as we just kicked off this morning, really?
Great. Super excited for what's to come, really.
All right. And your quick background is you're at Brooks right now, and what do you get to do there?
So right now I have the opportunity to be the program coordinator of the orthopedic residency down here in Orlando. So I kind of spend half of my time with patient care, which is awesome. But then I also get to spend time, of course, with mentoring the resident, teaching, doing some kind of program development. We're rather new, so it's our second year down here in Orlando, but our Jacksonville residency has been there for 17 years, I believe.
Yeah. So I host my own podcast. Today we're on the AOMT podcast, but I host my own. And I started mine when I was a student. And my episode number 1, we've done more than 1,600 episodes. Episode number 1 was, what the heck's a residency and fellowship? Because I was a second-year student, I started to hear about those things, but still had sort of no idea of what I was getting into. You've done both. Mm-hmm. You've done residency, you've done fellowship. What first inspired you to sort of go through those trainings, and how have they shaped your approach to patient care and clinical reasoning up until now?
Yeah, so I think a couple things to come to mind. First of all, I've had the opportunity to have some really good mentors in PT school that kind of opened my mind up to like what residencies, not really fellowships at that point in time, but what like specialization would do in terms of opportunities in practice later on. And so that kind of opened my mind up into like orthopedics. I knew I wanted to specialize or at least kind of do orthopedics. So I felt like kind of with their mentorship, that was really the best avenue as a residency. And, you know, I just really upon graduation, wanted to make sure that I had a really solid foundation to build upon with clinical reasoning and technical skills. And so, again, felt like residency was the best avenue for that. I didn't really ever picture myself going into fellowship. Mm-hmm. But once I got down here to Brooks, and really I credit it to the mentors and the faculty at Brooks, that I felt like doing residency wasn't the only step. It was only kind of part of the story. So from there, kind of halfway through my residency is when I realized that there was so much more to know in terms of being a PT, but also just to learn about the profession and what more there was to the profession. That's what really led me to kind of get into fellowship. And then, I mean, from there, I thought I would go back up to New York and keep practicing, but again, I had the opportunity to take the role as orthopedic residency coordinator down here. So to your second part of the question, is it opened up opportunities to continue to further my practice in patient care, but also share my knowledge with those that share a similar passion as me.
Yeah. And you kept going, because now you're on the other side of the coin. You've climbed the mountain, and then you're on the other side, which is you usher in new people who were in a similar space in their life that you were. So walk me through your role, as residency program coordinator Brooks, inside look into residency programs. What are you looking for maybe in a resident as well? How does someone know they're a good candidate to be a resident?
I think, of course, just being curious, keeping an open mind, being able to be comfortable with being uncomfortable. You hear that a lot. But I think that's what allows for growth. So someone that's willing to kind of take a challenge is definitely a big part, because we can teach technical skills, but if someone's not interested in, learning more, being curious, asking questions, then that's kind of a barrier.
You can't instill that in
Right.
someone.
Exactly.
You're either curious or you're not. It's either in your heart, your operating system, or it's not.
Yeah. So that's what I would say is we're looking for in
How do you
residents.
tease that out? Because on an interview, of course, they're going to be prepared for that question because they've listened to this podcast, right? So like, okay, got it. Make sure that they know I'm curious. But how do you tease that out?
Yeah, so I think, the application kind of gives us a better idea too of like how well-rounded the applicant is. So that helps to feed into it as well. But we do kind of live interviews, and I think where you get to see like some questions that they might ask after we ask questions. That kind of helps us gauge whether they have curiosity or are they just there to kind of provide you with answers. You know?
I always say an interview, job interview, anything like that, it's a two-way thing.
Exactly.
You shouldn't have that one question at the end when, do you have any questions? Here's my one question that I showed that I was prepared. This really should be a information exchange, right? That really is what the definition of an interview is. Yeah,
because we're investing time into them, but they're investing a lot of time into us as the program as well. So absolutely a two-way street.
Very much so. So now you mentor residents, all while still treating patients. Another cool mix of what you get to do at your job. How do you strike a balance, or how do you find a balance between those two important roles? And what do you find most rewarding about mentoring the next generation of orthopedic manual therapists?
Yeah, I think I do have a good mix between how much time I get to spend in the clinic, and I think knowing that I am at the end of the day also trying to share my knowledge with the current residents, it just makes me more motivated to continue to learn. I mean, we hear massive adaptive learner being talked about so much, and so I think that that's really just the key. Is I want to make sure that I'm the best I can be to my patients, number one, but then also the resident, because they're going to be I want to provide them with the opportunities that kind of residency and fellowship has provided with me.
Is there a fun moment in the last couple months that you've had, or an interaction with a student that maybe felt really rewarding? Like, I saw a light bulb go on, or this block has been overcome, or something that comes to mind with a real student?
Yeah, so student, yes, I actually have a student right now, and so I've seen kind of his interest in residency kind of grow throughout his clinical, and I think that that's just been some of the conversations that we've had and some of the manual techniques that I've been able to teach him, and it's just, again, there's so much they don't know that they don't know at that point, and so I think as part of residency, but also as his CI, is just to kind of show him how much more is out there so that he can be excited to kind of go on and seek further opportunities to specialize.
All right, so on top of everything else that we've talked about you doing, you also love translating research into practice. I mean, there's a good balance between education and what you do with students as well as your own practice. Share how your approach of integrating the latest evidence in clinical work, and what advice would you have for clinicians who are trying to stay current but might find it challenging because life happens?
Yeah. So kind of how, I've done it is, honestly, a lot of my ideas for like case studies have come from just conversations at conferences. And I've had the opportunity to work with some really great researchers at Brooks, and we have a collaboration with University of Florida. So some of those researchers as well. And so I've had the opportunity to present at a lot of conferences, and I love it from that aspect, but I also think sometimes researchers are a little bit intimidated to talk, or clinicians are a little bit intimidated to talk to researchers about ideas. So I think that I don't know what that would look like, but just trying to bridge the gap to make sure that we're more collaborative, and some of researchers, clinicians have ideas that they have the opportunity to discuss with researchers and kind of be more collaborative to move our profession forward.
Yeah. So get past that. They're not going to bite. Yeah. Probably. Right?
Definitely not.
Let's talk about future. What do you see as the biggest opportunities in physical therapy, in the profession right now, especially in the world of orthopedic manual therapy? What excites you in the next 3, 5, 7 years that you can't wait to see how it unfolds?
I think, that's definitely a challenging question. I would say that really just trying to invest more in our early professionals, and just beyond, like if they're going into residency and or fellowship, but there's so many great people in our profession that can continue to act as mentors to early professionals. And I think that, again, just collaborating more to kind of make sure that we're moving our profession in the right way.
All right. Last thing we do on the show, I call it the parting shot.
Okay.
What's something you'd want to leave with the audience? Mic drop moments, soapbox statements, or something is there something you repeat over and over again to your students because you're just like, I really want to make sure they get this? Is what comes to mind as we wrap up this little talk?
I would say kind of the underlying theme that I kind of started with is just stay curious and stay humble, because we all can learn from each other. So.
And you can put "Stay Curious" on a bumper sticker or a T-shirt.
Sure.
It's easy to remember.
Yeah.
Amber, appreciate your time here at AMP 2024.
Thank you so much. Thank you for all that you do for our profession.